Good morning. I want to talk about empathy and compassion and the crucial need for them. They are a necessary balm. We find ourselves in the most challenging time in this pandemic. Pandemic fatigue is a natural response. And over the 8 months that we've faced this pandemic, we have learned that there is no intention for this to go away anytime soon. It's forced us to spend more time at home. It's forced us to limit our contact with others, and also to worry about our loved ones, especially those who are most vulnerable with chronic medical conditions and who may not do well at all if they are infected with COVID-19. No matter our frustrations, we can't turn against each other. We're in this together. This pandemic has reached record levels. It's overwhelming our healthcare systems and our public health officials. If the number of cases do not slow, our hospitals are only a couple weeks away from the point where they will no longer be able to provide help for everyone who needs it. One of the 3 public health orders that I detailed yesterday went through the changes in isolation and quarantine orders. They did not get a great deal of attention, so I want to spend some time on that this morning and re-emphasizing those new orders. Because the number of new cases are so extreme, the Department of Public Health will not be able to contact everyone who tests positive or everyone who is a close contact of someone who has tested positive. This means it's up to you to let those who you've been in contact with know when you test positive for COVID-19 so that they can quarantine and they can get tested. We hear a lot about personal responsibility. This is an example of personal responsibility. And as we share this responsibility and notifying others who've been in contact with the virus, I ask you to do it with kindness. This is not a time to blame or to judge. Now is the time to make sure that everyone who needs it gets the care that they need. We live in a world of anxiety, and this pandemic has us all on edge. I've talked to so many people who are living in fear, seeing this virus not something that is a possibility, but something that is inevitable. We may have fewer opportunities to meet in person, but let's work to communicate with others, especially those who are most isolated, those who are at high risk, and those who are struggling with the uncertainties in this unprecedented time. As a top elected official in St. Louis County, this pandemic keeps me up at night. As a doctor, it's really hard to think about anything else. As a husband, as a sibling, as a father, and as a son, I worry about my family. Where are they going? What are they doing? And what can I do to keep them safe? In St. Louis County, our Department of Public Health is reaching out to those who are most likely to spread the disease to others, those who have tested positive. But we can't get to everyone. Those who test positive must immediately isolate, and they must let everyone know who they've been in contact with that they need to self-quarantine. So if you've tested positive for COVID-19, you need to isolate for 10 days. 10 days from the time where you tested positive, or 10 days from the time where you had the first symptoms. You must also notify everyone who you've been in close contact with so they can quarantine. And a close contact is defined as anyone who you've been within 6 feet of for more than 15 minutes total time at any point during the day. So if you were a close contact of someone who's tested positive with COVID-19, then you have to quarantine for 14 days. 14 days from the time that you were last exposed to them. If you come down with symptoms of COVID-19, then you need to get a test. You need to take steps to notify anyone in your family, your friends, or your workplace if you've tested positive and you may have exposed them to this virus. They need to quarantine. The Department of Public Health will no longer be providing release from isolation or release from quarantine letters. Your primary care physician is authorized to provide you with a release from quarantine or a release from isolation letters. If you do not have a primary care physician, then you can contact our Department of Public Health, and we'll work with you. Schools and workplaces should no longer require a release from isolation or release from quarantine letter from the St. Louis County Department of Public Health. For instructions on how to isolate or quarantine, you can go to our website, stlcorona.com, and there are details about the public health order and how you can protect yourself and others. If we all work together, we can keep this virus at bay. And I want to thank everyone so far for all of their help. These measures are so important. We know that our residents are hurting, and so many of our residents feel like they've been overlooked. The pandemic is just another chapter of spotlighting the indivisible nature of so many of our residents. As we talk about others and continue to provide access to testing and health care, we must do so with the priority of those who have been most vulnerable, those who have been overlooked over and over again, those who have been disproportionately affected by this virus. If any good can come from this virus, it's responding to this pandemic in a way that's equitable, in a way that demonstrates that those who have been overlooked over and over again won't have to struggle. They won't always be at the end of the line. I made a commitment when we received our federal CARES Act fund that these funds would go to those who are most vulnerable. And that's exactly what we've been doing. We focused on our most vulnerable neighborhoods. We've set aside $19 million for our small business relief program, and we set aside $47 million for our municipalities to help with their public safety expenses in response to the pandemic. It's my hope that the new administration in Washington will provide another federal stimulus package so we can continue to get money out into our community to those who need it the most. Our families are hurting, our businesses are hurting, and we need more resources. As for those other orders I announced Friday, they bear repeating. They too will go into effect in less than 16 hours. Our safer at home public order means that you really need to stay home unless it's necessary to be out, necessary to go to work, necessary to go to the doctor, to get food or other necessities. There are exceptions, of course, for those who are going to a place of worship, to visit other family members, or visiting members of your support bubble. Your support bubble should be no more than 10 other people, including your friends and family. Within these bubbles, a person cannot belong to more than one group. And when this group gathers, everyone should continue to practice social distancing, wearing a mask, and other protections and precautions to prevent the spread of the virus. If a family member or person in the bubble becomes sick, then it's your responsibility to tell everyone else who might have been exposed so they can quarantine and get a test. You and your family member are always going to be safest if you stay at home. You may be asymptomatic with the virus, and you could be spreading it to others unknowingly, or you could become in contact with someone who's asymptomatic, and then you could pick up the virus as well. Anything you can do at home will always be better, including working from home if that's possible. The order also prevents gatherings of more than 10 people. Currently, the limit on gatherings in St. Louis County is 50. Restaurants cannot offer indoor dining, but outdoor dining, takeout, and delivery are permitted. For bars, delivery and carry-out only are permitted. And I want to stop for a moment and talk about restaurants. I know you're doing all you can to abide by the rules, and I want to thank you for that. The new order will be challenging, and I know that many of you are working to extend outdoor dining for as long as possible. And if you have questions on how to do this safely, please contact our Department of Public Health at business-covid@stlouis.com. That's business-covid@stlouis.com. Businesses must also reduce their capacity to 50%, as identified by the fire code, down to 25%. Exceptions are hospitals, medical offices, and schools, and all this is outlined on our public health orders at stlcorona.com. Also effective Tuesday, face coverings must be worn by anyone over 5 years of age when they leave the house. And this includes when visiting someone else's house. Exceptions can be made when eating, but only when the diners are socially distant, 6 feet apart. Included in this order is anyone at a gym who must wear a face mask when working out. Participants in organized sports must wear a face mask as well when playing a game. Also included are students in a school setting, except when they are eating, participating in a gym class, or participating in a music class, but always when socially distant. While 3 to 5-year-olds aren't included in this order, they're encouraged to wear a face mask as well whenever possible. Other exceptions include anyone who has a medical condition that prevents them from wearing a mask, or anyone who's in the water at a public pool. And I want to be clear, none of these orders are meant to be punitive. They're public health orders crafted by our public health experts in close cooperation and contact with members of our St. Louis Metropolitan Pandemic Task Force and other experts in our medical community. Our regional healthcare leaders are sounding an alarm. It's not a matter of if they cannot provide care to everyone, it's a matter of when. We are in a dire situation. We're 2 weeks away from our hospitals and healthcare providers making these difficult choices. People who are very sick, people who have suffered heart attacks or strokes, people who've been in a car accident, people who've been involved in a violent crime. This is not politics, so please stop politicizing this. This is a pandemic. This is making people sick. This is not the cold or the flu. This is a deadly virus. Thousands of our residents are frightened, and rightfully so. Thank you to our healthcare workers. You've been heroic in your response. Thank you to all of our frontline workers, those who are allowing us to be able to get groceries, to be able to get medications at a pharmacy, to be able to fill our cars with gas, to be able to try and go on with our lives as much as possible. I too would like this to go away, but it's not going to happen until we have a vaccine and everyone's been able to get it and develop immunity. We can make it through another 6 months. We've made it through 8 months already. And that's what it's going to take. It's going to take our commitment to doing the right thing. So let me stress this again. Be compassionate, be empathetic. If you are told by someone that you've been exposed to the virus, take that, recognize that as them telling you that they care about your safety and they want you to be able to do the right thing and to protect yourself and your family. And if you've tested positive for the virus, it's up to you to do the right thing, to let those who you've been in contact with know so they can be quarantined, they can take care of themselves, and they can get a test. I believe in St. Louis County. We were the first county in the state to have a case of COVID-19. We were one of the first places in the country to establish stay-at-home orders to protect our residents, and we must continue to be a leader in our country to keep our residents safe and set an example on the best way to respond to the pandemic. Thank you, and I'd be glad to take any questions.
Dr. Page, there's a lawsuit, or at least a court action in the works with Bartolino's and other restaurants saying that they don't feel like it's fair for no indoor dining in St. Louis County, where as other municipalities, the city, adjoining counties are still allowing indoor dining. What's your response to that, and is there a case to be made there for some equality, allowing them to keep indoor dining when other municipalities are doing so?
The question is about social media rumors about the possibility of litigation about our public health orders and how they affect restaurants and indoor dining. We've gone through this before. Our public health orders are pretty firmly established in law. The decisions are based on recommendations from our public health experts in our medical community. As for any business sector, restaurants or hotels or others who have been impacted by this COVID-19 pandemic, as for them being disadvantaged, they are. This virus has disadvantaged everyone. There's been terrible loss of life in our community. People have lost their jobs. Businesses have lost significant amounts of revenue. Some have been forced to close. And this pandemic has been a terrible tragedy for our community. We have seen different regions of the country respond differently, and we've seen different outcomes of those responses. Here in St. Louis County, we have unique demographics. We are an urban county. We were impacted early on by this virus, and we will make our response based on the opinions of our public health experts, their advice, and the medical community.
But is it that much different in the county than in the city?
The city and every jurisdiction has to make a decision on how to respond. And the St. Louis County, at this point in time, the cases are a little worse than what's going on in the city. But we are going to closely follow the recommendations of our county public health department and the medical community who are advising us.
What numbers or hard evidence do you have that the rise in cases in the county are coming from bars and restaurants?
The rises in the cases, so the question is about evidence, about cases, and the decisions that we're making in the public health department. And this is a criticism that we faced since the beginning, that every community, every public health community faces across our country. We do have evidence of transmission around every sector that is impacted by our public health orders, and our public health orders are evaluating that evidence, that data, and making public health decisions made by public health experts after evaluating the information that they have from exposure, from case investigations, from investigations of close contacts. And all of our recommendations are made by our public health experts in close contact with our medical community. Anyone who is negatively impacted by any of our public health orders in any of our business sectors, in any of our industries, will always be frustrated by that impact, and we feel badly for them. But all of our public health decisions are made based on public health experts after reviewing the data that's been available to them.
Is anything being done as far as preparing for overcapacity? And I guess the second leg of that question would be, what is the county doing to prepare for if and when this vaccine comes down, and how to distribute it?
Yeah, so we're working with the state, the Pandemic Task Force and the hospital systems are working with us so that when the vaccine comes available, we can distribute it. It will first go to frontline workers and the most vulnerable populations, and that distribution will roll out as quickly as possible. In the first wave of the vaccine, we hope will be towards the end of this year or the beginning of the next year. Getting that vaccine out into the community and getting those who have been identified as high risk vaccinated first will take some time. We expect a second wave of availability of the vaccine for those who are not frontline workers, who are not high risk, and that will happen a few months, 1 or 2 or 3 months later, depending on how quickly we can get the vaccine into the population. Once the vaccine is available, the current models, the current vaccines are 2-shot vaccines, the second shot coming 4 weeks later, and then immunity develops sometime after that. So we recognize the advice that we have from our public health officials and our medical community that once a vaccine becomes available, that is the beginning of vaccination and not the end. And the process of vaccination will take several months. The process of developing immunity will take several months, and it will be several months from when the vaccine first becomes available to when we have immunity and we can relax our activities and our restrictions and our masking.
Could you clarify the outdoor dining requirement? Is that only at 25% as well?
Yes.
Okay.
And I would recommend that everyone who is considering setting up outdoor dining, make sure they contact our Department of Public Health to make sure they're following the capacity restrictions and the airflow guidelines for outdoor dining. Outdoor dining can't simply be a structure that is new. It has to follow the airflow guidelines, or it will not provide any benefit. And I would encourage everyone who has questions about outdoor dining and making sure that that complies with our public health guidelines and that is safe for their employees and their customers to make sure they've contacted our Department of Public Health.
So what would be your message to bars and restaurants, Dr. Page, as they try and make it through this time in the county?
For bars and restaurants, we recognize that this is a very difficult time. This is a very difficult time for all of our businesses. This is a difficult time for hospitals and healthcare providers. This is a difficult time for people who have tested positive, who are in the hospitals, who are struggling for their lives, and difficult time for families who have lost their loved ones. And we're all going to work through this together. We need more resources from our federal government. We need a continuation of the PPP program, and we need our folks in Washington to come together and come up with another relief package for all of our businesses across our country, all of our businesses who are negatively impacted by this pandemic.
I just got a tweet and someone just asked this question. They say our tents seem to be technically indoors, so what's the difference between having that capacity inside versus outside?
So a question about outdoor seating and how is an outdoor tent different than an indoor dining facility. And I would refer anyone who is considering setting up an outdoor tent for outdoor dining to contact our public health department and make sure that the proper airflow is maintained for outdoor dining and that it truly is an outdoor experience that is well ventilated, because the difference between indoor and outdoor is making sure that it is ventilated and make sure they follow all the guidelines of our public health department to make sure that it is safe for their customers and for their employees.
I just want to clarify, did you say they're not doing contact tracing at all anymore, or they're just?
You know, our questions about contact tracing by our County Department of Public Health. One of our new public health orders is to require anyone who tests positive to notify anyone they've come into close contact with. And that is because contact tracing by public health departments is much less effective when the positivity rate in a community is over 5%. In St. Louis County, where between 16 and 18%, the rest of the state is between 30 or 40% or more. And contact tracing is much less effective in that setting. So what our county health department is doing is focusing their contact tracing efforts on those who are most likely to spread the disease to others, the virus to others. We're going to put our efforts where we can do the most good. But we have changed our public health orders to require anyone who tests positive to notify their close contacts, because contact tracing by a public health entity just does not work well when the positivity rate is over 5%, and we're well past that.
So those people who are being paid as contact tracers will still be employed?
Yes, we're still hiring more contact tracers. We will continue to do that. But there is no model in public health where contact tracing works as well as it should or effectively when the positivity rate is over 5%. And we went over 5%, 3 or 4 weeks ago.
Dr. Rich, how effective can the orders here be when adjoining counties aren't doing the same thing?
The public health orders in St. Louis County that are in place when adjoining jurisdictions do not have similar orders will still be effective, and they will help a great deal. They will not they will not be as effective if our neighboring jurisdictions, as they would be if our neighboring jurisdictions had a masking order or had more restrictions, but they will certainly be effective. They will certainly save lives in St. Louis County, and they will certainly help us suppress the virus. St. Louis County has a population of over 1 million people. It is well over half of the folks in the metropolitan area on this side of the river, and it will have a great impact on the spread of the virus in our community. We would be better off in our region and our state if we had a statewide masking order. We'd be better off in our country if we had a national plan to respond to this virus, but this is where we are, and we're going to move forward with the resources we have to try and protect the health and welfare of everyone in St. Louis County. Okay, thank you.
Dr. Page, one more thing. Could you give out the address again? I think we may have had it wrong in the remarks. business-covid@stlouisco.com.
Yeah. Okay. So the for business guidance for anyone, especially bars and restaurants who are looking to set up an outdoor dining opportunity, would refer you to stlcorona.com or business-covid@stlouisco.com.
Thank you.
Okay, thanks.